6:44 this Monday morning. 3 News Now is looking at ways to help you and area businesses overcome the effects of the pandemic and rebound from them. Well, during this pandemic, many of us have seen firsthand how understaffed hospitals are and how overworked nurses are. 3 News Now reporter Danielle Davis takes a closer look at the critical nursing shortage we're facing and what's being done to get more people into nursing.
Nebraska is projected to have a shortage of about 4,000 nurses over the next few years.
Look at my nose.
The current nursing shortage has nurses working longer and more difficult shifts, wreaking havoc on them physically as well as mentally.
We go nonstop 7 to 7. There's very little time to take a lunch break, but the 30 minutes that you get for your lunch break, you have to take it just to take a breather and not have the responsibilities on your shoulder for the critical care patients that are on our floor.
The projected shortage in the next few years is due to several factors.
COVID has made things worse. We have a shortage in part because the population is aging, and often, not always, but often as people age, they need more health care.
To help fill the gap, UNMC has several new programs to get more people enrolled in nursing programs.
When we're taking our days off, we're getting called in to see if we'll work. And then there's also a bonus incentive for staff nurses that if they'll stay over the next 3 months rather than become a traveler, they'll get X amount of thousands of dollars.
There is an accelerated 8-week program. Current nurses can work toward a master's degree, and there are certificate programs for internationally educated nurses.
What we're seeing in the hospital is that nurses really are just working so hard, and it's not easy to do in full personal protective equipment. It's necessary, of course, for safety, but it's just very difficult and very challenging to do that. And then, of course, there's the acuity level of many patients, and that's just hard to see on a day-to-day basis.
We need to have some empathetic individuals that go into nursing that want to take care of people, because it's not easy work. You're in there, you might have a pleasant person, but for the most part, you're in there working with someone who's angry that they're there, they're sick, they're not feeling good.
Getting more nurses in the programs will relieve some of the burden for our current nurses.
I always go in with a smile, because if I can make that person laugh at least once before the end of my shift, then I've met my goal for the day.
There are also nursing programs where you can actually work in a hospital while going to nursing school. According to the U.S. Bureau of Labor Statistics, the job outlook for nurses is expected to grow by 15% over the next few years, which is much higher than the national average. In Omaha, Danielle Davis, 3 News Now.
Now, UNMC has scholarships available as well as other methods of financial assistance. You can look into their nursing programs by visiting unmc.edu/nursing and click on the nursing program link.